What's the matter with Medicaid? Has Germany's manufacturing policy been successful? And are Greece and Argentina the new role models for fiscal responsibility? I'm Dominic Pino, Thomas L. Rhodes Journalism Fellow with the National Review Institute, and we'll look through those questions on this episode of eConception. eConception is a podcast of the American Institute for Economic Research that looks at the economic issues of the day and broader economic concepts behind them. We're recording today on location from the bank account holding California's federal Medicaid funds. I just saw Scrooge McDuck swim by a minute ago. Medicaid is not the biggest part of the federal budget, but it is one of the fastest growing. The only one rivaling it is interest payments, unfortunately. And Medicaid is supposed to be a program for poor people to have health insurance. And that's a goal that most people would agree with, but it has been expanded and expanded over time to cover lots more people. And it's actually, in some ways, making poor people worse off and making it harder for them to get access to care because it's being crowded out by people who aren't poor. And to talk about that issue, I have Brian Blase, who's the president of Paragon Health Institute, and Paul Winfree, who's the president of the Economic Policy Innovation Center. Last episode, of course, was just me, a solo episode. So now I'm giving you two guests, and not only two guests, but two presidents. So thank you so much for joining us. I want to start with you, Brian, to talk about the growth of Medicaid. This program that started as being for poor people was expanded under the Affordable Care Act or Obamacare to cover a lot more people. Can you talk a little bit about just sort of what the changes to the program were there and how it is one of the fastest growing programs in the federal government?
Yeah, and thanks for having me on. So there are twice as many people enrolled in the Medicaid program now as have income below the poverty line. So the program is no longer just for the poor. When it was created back in 1964 in the same legislation that created the Medicare program. It was for certain categories of low-income people. So people with disabilities, low-income children, low-income seniors on the program have Medicaid pay some of their Medicare expenses. It gradually began to be expanded in the mid-1980s, but the big expansion came with the Affordable Care Act. That took effect in 2014, and it expanded the Medicaid program to able-bodied working-age adults. It also created a much different financing structure for those individuals. So for traditional Medicaid enrollees, the federal government provided an open-ended reimbursement of state Medicaid spending. It provided a higher percentage in poorer states, but on average, it was about 60% of state Medicaid spending that the federal government reimbursed. For the Affordable Care Act population that came on, the federal government offered 100% reimbursement. So states were spending with entirely federal money. Now that rate has gradually declined. It's now at 90% on paper. We'll get to, in actuality, it's still 100% in most states. So what's happened, if you let states spend entirely with federal money, the incentives facing states are to enroll a lot of people in the expansion, to classify individuals who would be eligible under traditional criteria as expansion enrollees, because states actually make money when they improperly classify people as expansion enrollees now. So it led to a surge of growth in the program. We now have close to 20 million people enrolled in just this expansion of Medicaid, many of whom don't actually qualify for the expansion criteria, but again, states haven't done proper eligibility reviews because they don't have incentives to do so. So we're now looking at a program that is covering about 1 in 4 Americans. And that's on the coverage side. On the spending side, there's been a dramatic growth in the program as well. If you just go back and look at the spending growth over the last 4 years, so if you go back to what CBO thought the Medicaid baseline would be at the start of the Biden administration to what it is now, it's $1.2 trillion higher now than what the Biden administration, when they took office, if you look at the projections for over the next decade. So dramatic growth in the program. Two main reasons for the dramatic growth over the past couple of years in the program. The Biden administration made it more difficult on states to remove ineligible people. And it also enabled these massive state money laundering schemes that result in states getting federal Medicaid money without any state expenditure. And those schemes have really taken off over the last couple of years. So I'm excited to talk about Medicaid money laundering later.
Yeah, no, can we get into that now, actually? Because I think it's a provocative term to call it money laundering, because that's obviously a crime. But all of this stuff is permitted under the law and to some extent is encouraged by the law.
Yeah, so it's mostly legal. There are some state schemes that the Government Accountability Office has come in and said don't meet the criteria. But here's the basic explanation for why we have so much money laundering. So the federal government provides an open-ended reimbursement of state spending. The more states spend, the more the federal government contributes to the states. And states in the mid-1980s realized that they didn't need to actually have expenditures. They could develop fake expenditures. The classic example is the so-called provider tax. So under the provider tax, the state will go to the hospital and tax the hospital, say, $1 million. The state will then spend that $1 million in Medicaid payments right back on the hospital. So most people would say, well, there's no actual real economic transaction here. But the federal government will then see the state's expenditure and reimburse the state for that accounting gimmick. And on average, the federal government's reimbursing about 70% of state expenses. So states can take that accounting gimmick of that $1 million just changing between the state to the provider back to the state and get $700,000 for that. And the state can use that. They use it on the providers, so they'll increase the rates to the providers. They could use it in other ways too, though. They could use it for roads or transportation, really whatever. It's a slush fund for the state. The federal government allows these types of schemes within certain limits. There's been some tension between the federal government and states over the years, but they've proliferated over the last few years. And states are now making very large payments to politically powerful providers through these mechanisms. So last year, the Biden administration finalized a rule that clarified that states could pay up to average commercial rates through the Medicaid program using these supplemental payments. Average commercial rates for hospitals are 2.5 times Medicare rates. So through these schemes, in many states, for many providers, Medicaid is now a much better payer than Medicare.
And I think I saw somewhere that the federal matching funds for Medicaid to the state of California are greater than the entire state budget of Florida. Is that right?
Yeah, that was actually in the Wall Street Journal, an editorial last month. And yeah, the federal Medicaid expenditures in California exceed the entire Florida state budget. California and New York have almost 40% of their populations enrolled in the Medicaid program. And both of them have taken advantage of the Affordable Care Act and the huge, windfall that states get because the federal government's reimbursing 100% of the cost. There is a real problem between the Affordable Care Act and the money laundering. So if you think about it, $1 of money laundered funds in the Affordable Care Act will bring in $9 of actual federal funds. So the return, the ROI on money laundering in Obamacare is 6 times greater than the return on the money laundering for the traditional populations if you use a 60% FMAP. So you've seen sort of this proliferation both with the economics from the Affordable Care Act with the increased sort of permission around these money laundering tactics, just an explosion. So the Wall Street Journal had a really great piece on Sunday looking at certain hospital systems and how much of their revenue they're getting from these Medicaid supplemental payments. And there's a hospital system that's headquartered in Nevada that's getting almost 70% of their revenue from these Medicaid supplemental payments, basically for this money laundering scam. So there are, and Paul and I have we've highlighted the Molina CEO. Molina is a insurance company that almost entirely has a Medicaid business model. And the CEO in 2023 took in $120 million of total compensation. So you're looking at sort of a lot of these industries, hospital systems and insurance companies making massive profits through what is a welfare program. And it is just a terrible place for our healthcare public policy to be, that industry can get so wealthy and rich off of designing, financing shell games through a welfare program.
Yeah. So, Paul, you wrote to the Wall Street Journal making the moral argument about this that says that, in effect, what these programs do, in addition to contributing to bankruptcy of the federal government, they also crowd out care for the people who Medicaid is supposed to be for, the people who are disabled, children who are poor, and creates basically incentives for the states to prioritize able-bodied working age people who really the program is not for them anyway.
I mean, that's exactly right? The big deal, and Brian kind of talked about this a minute ago, but the big deal the Democrats made with the healthcare industrial complex when they passed Obamacare was, if you cover who we tell you to cover, and if we cover what we tell you to cover, we will make you incredibly rich. And that is exactly what they've done, right? There have been a major consolidation of hospitals across the country. There have been major consolidations of physician groups across the country. And those things haven't really helped consumers. They haven't really helped patients, right? At the same time, we've had health insurers pop up specifically to take advantage of these government subsidies. So Brian highlighted Molina, but Molina's not the only one, right? The highest paid healthcare insurance CEOs in the country are making almost 100% of their revenues from the federal government. Molina is sort of an outlier. 88% of the covered lives that they covered last year were in the Medicaid managed care space in 20 states. All of the other revenue that they're bringing in is either in commercial plans that are subsidized by Obamacare or Medicare Advantage. Like, as Milton Friedman talked about, and I'm sure you've talked about Uncle Milton on this podcast, the profit incentive is good, right? We want the profit incentive. We want to encourage the profit incentive. At the same time, you need the loss incentive too, right? That's the other side, right? And if 100% of your revenues are covered by the federal government, and all you have to do to make sure that they keep coming in is to spend a fraction of them lobbying the right members of Congress or the right state legislatures, like that's we used to call this public corruption, right? And that's a big problem. Brian talked about, one of the major problems with Obamacare is the way that the system is financed. And the way that they got states to take up the coverage expansion was by covering a large portion of the cost of the expansion population. They realized that if they didn't do that, then states wouldn't take it up, right? And so they started at 100% and they phased it down to 90%. But what that means, and again, Brian kind of got at this already, is that states have an incentive to focus on the expansion population because that's where all the dollars go. They get 90 cents on every dollar they spend on the expansion population. But in states like even California and New York, rich states, they only get 50 cents on every dollar that they spend on the vulnerable population, on the disabled, on the pregnant moms, on the kids, right? And so what that leads to is just a reprioritization of how states are developing their Medicaid programs. And what we've seen is in some cases, and in fact, a friend of all of ours, Rachel Barkley, who used to work for Kathy McMorris Rogers in the House, now she's on the outside affiliated with some think tanks, but she recently wrote a piece in The Hill that talked about how, in some states you have folks who are on, like years long, 7 years, 10-year long waiting lists in some cases for home health care because they're in this vulnerable group that gets reimbursed at a lower rate. And so what we're doing by encouraging the Obamacare expansion is we're literally incentivizing states to prioritize the able-bodied without kids who are working age over the disabled and the pregnant moms and the kids. And in my view, and I think if Americans, if we all knew about this, we would say that's completely backwards. That's nuts, right? The entire intent of the Medicaid program when it was created in the mid 60s was to make sure that the vulnerable folks had access to healthcare. There's a question about whether or not access to Medicaid actually gives one access to healthcare that is valuable to them. That's a separate question altogether. And Brian's done a lot of work on this in the past. But the financing structure is just completely and utterly backwards, and not only prioritizes care in areas that I honestly don't think we should be prioritizing, but it also incentivizes all of this Medicaid money laundering that Brian's talking about, that we've really tried to hold a microscope up to show people what this really means and what it's really leading to. Because again, they're getting 90 cents on the dollar for Medicaid money laundering, whereas 10 years ago, they only got 50 cents on the dollar for the money that they were laundering.
So, the United States is a very, very rich country. The federal government could provide health insurance for the actual poor people and the people who are actually in need at a very much lower cost to the taxpayer and to everybody else than what they are spending on Medicaid right now. We've got situations like Brian mentioned where you have 40% of people in California and New York are on Medicaid, two of our biggest states population-wise. 40% of people in those states are not poor. That's just wrong. And so it would suggest that you could cut a lot of the spending here. You could do that without cutting anything for people who are actually in need. But it seems like it's politically impossible to do that. And on top of that, there's the federalism question, because this is supposed to be a joint program between the states and the federal government. And yet over time, the funding has become more and more from the federal government and less from the states. But the states are still the ones administering it. So like you said before, they don't really have a great incentive to make sure that the money is being spent well, because it's not their money to begin with. So Paul, what do you think we can do about this from a federal budgeting perspective to actually focus on the people who need healthcare and to get it to be a sustainable program so that those people in need can actually get what they should have?
The fiscal federalism question is actually much larger than the Medicaid program. One of the things that we've seen over time is that the federal government is funding more and more of what was funded under state general revenue. So if you look at all of the money that comes into the federal treasury and then flows back to the states, and then you compare that to what the states are actually raising on their own, that segment of the pie of the federal treasury that's going back to the states is growing tremendously. And, one of the reasons for that is that in 2008 and 2009, during the great financial crisis, states were hit really hard. And the federal government, thought that every time we had a crisis, we needed to bail out states. Fast forward to the pandemic, and what happened was that we overcorrected for the lesson that we thought that we should take away from 2008 and 2009. And so from 2020 to 2023, we just dumped hundreds of billions of dollars into states and local governments, and they are now flush with cash. And that's a big problem, right? Because the decisions about how to spend that cash are disconnected from the people who the cash is raised from, right? In some ways, entirely like these people aren't even born yet, right? Because the federal government is issuing debt to pay for that spending. And it's a big problem in a democracy, right? So the problem with Medicaid is, again, that the federal government puts all of these requirements on states. And then when you have, like, the Biden administration comes in, right, their goal is to expand the program to get states to take it up. And so what they do is they put out all of these carrots to get states to push Medicaid out there. And that's one of the reasons why the Biden administration, waived eligibility checks. It's one of the reasons why they pushed, the payment to providers up to commercial rates. This is to make Medicaid look more attractive. And it's also to get the local politics working, where, the provider groups, the hospitals, the insurers who are operating in the states, they're going to the state governments and they're saying, look, there's all this free money from the federal government. All you have to do is take it. It's right there. It's right in front of you, right? And the states, like this governor, look, the most conservative Republican governors have this massive incentive to take that money and to do conservative, I'm using inverse commas for the listeners, conservative policies, right? Like tax cuts, right? What Republican governor in America doesn't want to cut taxes? Well, this is how they're financing it. They're financing it with the money that's coming in from the federal government for these programs that historically should be and have been funded by states, because the states and the local governments are the ones making the decisions around the policies that control or implement these programs. We see the same thing with the way that the SNAP or the food stamp program is financed and implemented. Like look at what's happening right now, right? Like states are trying to put some more prescriptions around what food stamps can be used for, like sugary beverages and things like this. And the grocers and big sodas coming in and going, this is free money from the federal government. Why would you turn that down? This is insane, right? And so the Medicaid program is just special in a way because it's so large, and and healthcare is because everybody needs healthcare, right? I mean, healthcare is important, and so that's the reason why Medicaid is such a key piece of this. But really, this is a much larger issue than just Medicaid.
I mean, let me add to that. So the key, what we're focused on, is incentives. So how can we align incentives for states to care about the value of spending and not just grow programs to get more federal spending? Exactly. Because states do view, and they hear from the industry, they view Medicaid as an economic stimulus program. We spend more, and because of money laundering, we don't actually have to spend more. We could just create financing gimmicks, but we either spend more or we gimmick more, and we get actual federal dollars that flow into the state that boost our economy. Now, when all states act like this, right, we get large and growing federal budget deficits and all of the negative effects that we get from federal budget deficits in terms of inflation and interest rates. So there are significant costs that come from this system that we have enabled states to build. From a conservative perspective, the long-standing reform for Medicaid has been to block grant the program. So states get a certain amount of money. They need to spend that money within some federal rules. But if they spend above that amount, it's entirely state financing costs. So states would have actual incentives then on the margin to make sure that the value of that spending equates to cost. So if states want to take state dollars and raise hospital prices through Medicaid to average commercial rates, they can do that, but they would have to face what the trade-offs are, which would be higher taxes, lower education spending, less investment in transportation and infrastructure, less public safety measures. But we don't give states that incentives right now. States have no incentive to be cost conscious about their Medicaid program. So I used to think of Medicaid and describe it as the Pac-Man of state budgets because states had this incentive. I no longer view Medicaid as the Pac-Man of state budgets. Like, I don't think that Medicaid is crowding out everything else in the budget. It's just leading to overall state spending increases financed by the federal taxpayer. I would say for conservatives right now, and what we are really focused on are politically feasible reforms at the current moment, the 90% match rate for the expansion population, which is really higher than that because like the rates that Paul talked about, they're the paper rates. They're not the actual rates because the states money launder so much of the state share. So most states expanded using money laundering and gimmicks for the state share. So they are not paying anything for the expansion population. So states, we need to lower the 90% reimbursement. It discriminates against the most vulnerable. We have evidence that it hurts kids and people with disabilities. That 90% needs to come down. That's the most important aim, I think, right now for conservatives on Medicaid reform. And that states actually have to bear the share of that 10%, right? I think that 10% should increase over time. The rates for all enrollees on the program should be the same. We shouldn't have a much higher rate for able-bodied childless adults. Paragon polled this too. Like, we asked the American people, do you support lowering the federal Medicaid payment so that the federal government pays the same for able-bodied adults as it does for children, pregnant women, seniors, and people with disabilities on the program? It's overwhelmingly popular, like 2/3 support for that. So there are ways to discuss this and frame this where Medicaid reforms can be popular. So getting at that 90% Obamacare enhanced match rate, the most important. The second is to make serious reforms on this money laundering. So for instance, Paul and I, we did a joint paper last month on California. California provides a really nice example of a recent state scheme. So they designed one of these taxes on insurers. They get their tax revenue from the insurers. They then take that exact amount of revenue and spend it on the insurers in higher payments. They bill the federal government for that. So the federal government reimburses about 60% of the cost. So California got $10 billion in federal funding that it deposited right in its state general fund from a financing gimmick. The next year, California took two actions with its Medicaid program. It expanded Medicaid coverage to every unauthorized immigrant in the state, and it lifted the asset test for Medicaid. So you can have unlimited assets in the state and qualify for welfare, which really it's abused most in the long-term care context, where people will place their older relatives on Medicaid to preserve their inheritances. Now, is that a good use of public dollars? No, it's a terrible use of public dollars. Does California be able to do that with federal tax money? Of course not. If California wants to do this crazy stuff, let them finance it. Don't let them pass the cost off to federal taxpayers. So we have to significantly reduce states' ability to engage in these money laundering mechanisms.
And the states aren't even hiding this. That's one of the many crazy things about this, right? When you go look at these state budget documents, every state says things like, we're going to have a shortfall this year, or, we're not going to be able to cover the costs for this program. How are we going to fund it? We're going to launder more money through the Medicaid program. Like they're clear about it. They're not even hiding it, right? And that's actually when Brian and I started digging into the specific Medicaid insurer tax scam that California is running. That's how we came across it, right? We're looking at these California budget documents, like they're literally they're literally saying 1 + 1 = 2. Here it is, And this is, it's something that's known. Like I said before, every state does it. Republican states do it. Democrat states do it. Everybody does it. It's just, it's something that ultimately deteriorates the connection between the taxpayer, or the people who are funding government, and the decisions that are being made about what government does with that money. And if you're actually worried about democracy and accountability and public corruption, like this is like low-hanging fruit. This is the stuff that we've got to go after.
Yeah, a hallmark of conservative governance is making trade-offs. You have to make trade-offs between finances and expenditures. And the way that we've designed the Medicaid program destroys conservative governance at the state level because they don't need to engage in those trade-offs. Many states are having budget challenges now. They're not looking at raising taxes or cutting spending. What they're looking at doing is creating another money laundering scheme through the Medicaid program so they can get federal money coming in with no actual state expense. And if Republicans in Washington have a chance to restore conservative governance to the state level, that is a big part of what the Medicaid reform effort is can we reform the way that states do their budgeting so they just don't look to the federal government whenever they have budget shortfalls.
And trade-offs are also just a basic component of economics, and that's what we talk about on this podcast. So let's hope they can do something about it. I think the best example of how crazy this is that provider tax, where you were saying how it's a tax on healthcare providers that the state then uses to spend on healthcare providers and to get more money from the federal government. So you have a situation where the entity being taxed is lobbying the government in favor of the tax. Yeah. That should be the number one sign to anybody who's concerned about government waste, government inefficiency, corruption, lobbying, any of these things. That should be a pretty big sign that this is a big problem. And the fact that it's such a huge part of the budget and a growing part of the budget, that's something that we have a chance to reverse. And let's hope Congress can do something about it. Thanks so much, Brian and Paul.
Thank you.
Thank you.
All right, enough about the United States. Let's look around the world a little bit. Germany is a country that often gets pointed to as an example of a successful manufacturing policy. And if you define success by having lots of people working in manufacturing, then I guess it is. Germany has an unusually high percentage of its workforce in the manufacturing sector for being as rich of a country as Germany is. What generally happens as countries become wealthier? I mean, let's start way back in history before the Industrial Revolution. Back then, basically everyone works in agriculture. Then industrialization happens, and the number of people working in agriculture goes down because they're moving into factories and into industry. So the number of people working in factories and industry goes up. As a result of that, the whole country becomes wealthier. So that's sort of the first step of a country becoming wealthier. But there eventually reaches a point where the number of people working in industry starts to go down too, because the number of people working in services starts to go up. This happens in countries that are already rich and are becoming even richer. So places like the United States, places like Germany. We all have lower percentages of our workforce in manufacturing today than we did 50 years ago. And the reason for that is because we're a richer country. And this happens everywhere in the world. So if you can think about it as kind of three different graphs. The first one is agriculture. That's just a downward sloping line. And in the US today, only about 1 or 2% of people work in agriculture. We've basically hit the bottom of that. And again, that's because we're a very rich country. We don't need to have that many people working in agriculture in order to grow the food that we need. Because agriculture is very efficient now. It didn't used to be. So that first graph is agriculture employment, and that's just down. Then you can think of a second graph, which is industry employment. Percentage of people working in industry. That one will be shaped like a hump. So it goes up first, and then it comes back down as countries become richer. And then the third graph would be services, and that line just goes up. So agriculture goes down, services goes up, and industry has kind of a hump shape, or an upside down U. And this is true across the board. There's really no exception to this. As countries become richer, their employment basically follows that pattern. Now, manufacturing employment in Germany has been declining, just like it has been in any country that becomes richer. But theirs is still much higher than the United States. According to UN data, about 19% of German workers are in manufacturing, and in the US, that's only about 10%. So it's almost twice as high in Germany as it is in the United States. And for many years, people looked at this and said, wow, this is a really great success for Germany, because they think manufacturing is sort of inherently good, and they think that the US deindustrialization has been bad, and so they think Germany has something figured out here. Now, the first thing to keep in mind is that Germany is slightly poorer than the United States in terms of GDP per capita, so we would actually expect them to have a little bit higher of a manufacturing percentage, just to begin with. But that's not the explanation for why it's so much higher. That might explain why it would be 1% point higher, but it's almost 10 percentage points higher. So what's going on? Well, Germany adopted many industrial policies over many years to encourage more people to be in manufacturing. This is a result of policy that they carried out. Has it been working? Well, Germany has had basically no economic growth since 2019. It's before the pandemic. They were in a recession before the pandemic. They've had another recession since the pandemic. The German economic story of the last 8-10 years is not good. So, and the US has been pulling away from Germany in GDP per capita since 2011. The year after that, in 2012, the US was about $6,000 per person ahead of Germany. Today, we're about $11,000 per person ahead. And that's all adjusted for inflation. That's all real growth. So the US has been pulling away while Germany has been stuck behind. And part of the reason for that is that Germany has been targeting and successfully encouraging manufacturing employment. Because when you understand what I was talking about before, that you have these stages that countries go through as they become richer, when you understand that that's how economic development happens basically everywhere in the world, then the idea of an already rich country like Germany, or like the United States, pursuing more manufacturing jobs, when we're on the other side of that hump of industry employment, it's a form of turning back the clock to when you were a poorer country. And that's basically what Germany's been doing. Or trying to, anyway. Because despite Germany being a very rich country, and despite it having the third largest economy in the world, Germany only has 2 of the top 10, 2 of the top 100. They have none of the top 10, but they have 2 of the top 100 most valuable technology companies in the world are in Germany. And those 2 companies are SAP and Infineon, and neither of them was founded in this century. These are all, by technology company standards, they're ancient. Because Germany didn't encourage that. They didn't set policy conditions. They didn't set an economic environment where the innovative companies of today could flourish. They set a policy environment where manufacturing companies could. And they did. They got what they wanted. But the US was able to have all this economic growth that Germany wasn't able to have. And we have something like 65 of the top 100 most valuable technology companies. And those have been driving economic growth for the country as a whole. Again, those are the kind of services jobs that rich countries have an increasing share of people working in. But the crazy thing is that while Germany was able to get this higher share of its population working in manufacturing than the United States actually still beat Germany in manufacturing output. or the amount of stuff they actually make. Because, you can have lots of people working doing something. It doesn't mean they're actually doing something productive. And sure enough, in the United States, between 2010 and 2021, manufacturing value added increased by 40%. In Germany, in that same time period, it only increased by 21%. So almost double the rate of increase in manufacturing output happened in the US over Germany. Again, this isn't total economy output. This isn't saying that it was wrong for Germany to target manufacturing. This is only looking at manufacturing. The US had better results. Another way of looking at it is that in 2010, US manufacturing value added was 2.7 times greater than Germany's. Obviously, the US is a much bigger country, so we would expect it to be much bigger. But the US was 2.7 times greater in 2010. In 2021, it was 3.1 times greater. So if it was really true that US manufacturing was declining and Germany's was rising, we would expect Germany to have closed the gap a little bit, but actually the gap went the other way. So if economic growth is your goal, the US has achieved that better than Germany has over the past 15 years. And if increasing manufacturing output is your goal, the US has also achieved that better than Germany has over the past 15 years. And has done so despite having a much smaller share of its workforce employed in manufacturing. So the German model doesn't seem to have worked very well. We should probably be honest about that now. So one model that the US is setting for the rest of the world is fiscal irresponsibility. We've seen this from both parties in the United States. Disregard for large deficits, no intention of resolving or reforming a lot of the programs that are contributing to those deficits, and a national debt that keeps going up by about $2 trillion a year, with seemingly no consequence. Now, of course, as any country that's had a debt crisis can tell you, the debt always seems like it has no consequence until it does, and it does at a time that's very surprising, because if we knew when a debt crisis was going to happen, we would have already fixed it. And the prices of government bonds would already reflect it. So crises always happen unexpectedly, at least as to their timing. We can say pretty confidently there's going to be a crisis, but we don't know exactly. But what we can't know is when it's going to be. So we can either wait for the crisis to happen and then try to solve the problem, or we can try to prevent the crisis by solving the problem now. But the U.S. has really no will to do that, and it hasn't been alone. The IMF did a study in 2024 across 65 different countries. And they found that parties across the political spectrum sound increasingly similar when it comes to fiscal policy. They all campaign on ideas of bigger government and promising more spending. So this has been a trend in a lot of the world. Of course, there's lots of countries that have been on this path for a while. Greece was one of the famous examples from the 2010s. The Greek debt crisis caused huge problems for the whole European Union and the euro currency. And we heard all kinds of stories about how Greek government employees were retiring at the age of 50 with these massive pensions, and the country had no possible way of paying for this stuff. And then, of course, there's always Argentina, which has been a just disaster on fiscal policy for decades. Under various military governments, dictatorships. And now that they're more of a democracy, they still have these problems. So it might be tempting to say, wow, the whole world is looking like Greece, or the whole world is looking like Argentina. But actually, in the last couple of years, Greece and Argentina have been doing great on this stuff. In fact, last year, 2024, Greece and Argentina both ran budget surpluses. I mean, this is crazy. If you would have explained this to someone in 2010 was a time when You had the Tea Party movement in the United States. You had Barack Obama talking about deficit reduction. You had the Simpson-Bowles Commission coming together, coming up with these ideas about how to cut the deficit. Talking about cutting the deficit was all the rage in the United States in 2010. And that was at the same time that Greece and Argentina were completely off the deep end. But now, only 15 years later, basically, it's flipped. Greece and Argentina are running surpluses. And the U.S. is running a $2 trillion deficit. Now, politically, Greece and Argentina could not be more different. Of course, in Argentina, you got President Javier Milei, who is kind of crazy. He's doing a great job with a lot of the stuff he's doing, but he's kind of a crazy person. He's a rock singer in a band. He's got his crazy sideburns and hair and all that. Waves around a chainsaw at his rallies, and reportedly he talks to his dogs, which are clones of each other, for policy advice. So that's one way to go about it. Now, the Prime Minister of Greece is a guy named Kyriakos Mitsotakis, and he is, boring. Very boring. He is a purposefully anti-populist, kind of like center-right-ish guy who wants to talk about reducing income inequality and stuff like that while also talking about fiscal responsibility. So we got one really boring guy, one super exciting guy, for sure. But both of these approaches have worked in both of these countries that faced huge fiscal problems. The example of Greece really stands out from the rest of Europe. Only 6 out of 27 members of the European Union ran a surplus last year. And the average EU country ran a deficit of 3.2% of GDP. Greece had a surplus of 1.3% of GDP. That's amazing. Not only that, Greece is a NATO member too, and it's one of the few countries that currently spends more than 3% of its GDP on defense. It's going above and beyond the current NATO guidance of 2%. And Mitsotakis also announced a $25 billion €25 billion modernization program for the Greek military. And in announcing this, he said, we're still going to be fiscally responsible. He said, this is a quote, "The ultimate judge is the markets and the sustainability of our debt. The flexibility must be used sparingly so as not to derail our path." That was the Prime Minister of Greece talking about listening to markets and reducing their debt. See, the government debt is an abstraction for most people until it isn't. During Greece's debt crisis, unemployment peaked at over 25%. Argentina had triple-digit inflation. That stuff matters to everyday people. Both of these countries were basket cases for a very long time, but they have proven that it's possible to turn things around. Despite their differences in personality, both Milei and Mitsotakis had the political courage to tell their countrymen that past politicians had lied to them. Reforms were necessary, and they had a plan to do it. They both found that voters were receptive to that message, and Mitsotakis has even won re-election. Milei hasn't had a chance to run for re-election yet, but we'll see if he's able to win another term in a couple of years. The results speak for themselves. An expected recession due to Milei's immediate cuts in Argentina's massive government spending has already given way to growth. Inflation's been cut nearly in half. Milei repealed rent controls in Argentina, which has made housing more affordable and massively expanded the legal housing supply. Greece's unemployment rate is at its lowest point in 17 years. S&P upgraded Greek sovereign debt back to investment grade in 2023, and then it upgraded it again earlier this month. And it was cited, the reason they cited for doing this was, quote, unwavering fiscal discipline. From Greece. IMF projects that Greece's economy will grow at twice the average rate for advanced European economies this year. And it projects that Argentina's economy will grow by 5.5%, which is faster than China's or Vietnam's. So Greece and Argentina learned the hard way that government debt matters. And they currently have leaders who are taking those lessons to heart and putting their fiscal policies on a different path. It might have been hard to explain to someone in 2010 that Greece and Argentina would be modeling fiscal responsibility for the world, but here we are. Now it's time for the paper of the episode, but before that, if you've enjoyed this episode, please subscribe and leave us a positive review wherever you get your podcasts. It helps us to know that you enjoy the show, and it makes the show more visible for others to start listening as well. I let Brian pick the paper of the episode, and it's not exactly a paper, but it's rather an experiment that has resulted in many papers. It's called the Oregon Health Insurance Experiment. Brian will explain.
So there's very few experiments in healthcare that look at the effect of health insurance. A lot of the studies on the effect of health insurance on health are observational studies, and there's tons of confounding factors between people that have insurance and don't have insurance. In around 2010, Oregon had enough budget surplus to expand Medicaid, but could only expand it for a limited number of people. So what they did was put together a lottery, and individuals that won the lottery got the chance to enroll in Medicaid, and individuals that didn't win the lottery didn't. This allowed economists to go in and actually have a health insurance experiment to look at the different health outcomes between people that won the lottery and enrolled in Medicaid and those who lost the lottery. So a lot of the nation's top health economists from MIT, from Harvard, Dartmouth, they did a years-long analysis and looked at the health effects of gaining access to Medicaid in Oregon. And what they found was consistent with the sort of the gold standard health insurance study that the Rand Corporation did in the 1970s. Gaining access to Medicaid didn't improve health, didn't improve physical health. So they looked at measures that you would expect you'd have health improvements if you got coverage: blood pressure, cholesterol, blood sugar, and there was no positive effect from gaining health insurance coverage. There was a positive effect in terms of people feeling more financially secure and some mental health improvements, but on the physical side, no significant benefits from gaining Medicaid. And it's really important for the discussion that we just had on the tremendous growth of the program. And we haven't seen health improvements among lower income Americans over the last decade. We've actually seen health stagnate or declining while we've had a massive coverage expansion. And from my perspective, the key takeaway is our health policy has been so focused on expanding Medicaid, on Obamacare and subsidies for the exchanges. And that there's obviously some benefits of that. There's some financial protection, but in terms of health effects, we haven't seen them. And I think it's a really important finding that we need to change the direction of our health policy away from just massive subsidies for Medicaid and Medicaid-like coverage.
The Oregon Health Insurance Experiment. Read about it. That's all for today. Remember, the economy is complicated and nobody has all the answers, but markets work.